The overall objective of the COVID-19 program, supported by Caritas Australia, was to promote preparedness, prevention, and mitigation measures to reduce the spread of COVID-19 in 5 dioceses of Zimbabwe, of which Caritas Archdiocese of Bulawayo was also a project participant. This was achieved through the following specific objectives. I'll start with number 1. Objective number 1, or outcome number 1, through increased levels of information and behavior change among 30,000 people on COVID-19 prevention and control. Our strategy was to have a broadcast service where every Sunday would reach out to the communities in Bulawayo Metropolitan and the catchment areas through Sunday homilies, where also the priests were also able to conscientize the communities on COVID-19. Through this broadcast message, a total which is approximately 300,000 people were reached, but we also take it on 10%, that 30% were really taking points out of behavior change when it comes to COVID. Our other key target point were the parishes where COVID committees were coordinated at Archdiocese level. The purpose of the COVID committees was to be communities, role models, or field agents where they assist when it comes to funerals. They can put order when it comes to getting into masses. And thirdly, within the rural communities, we had representatives whom we call ambassadors. Their role also was to ensure they conscientize the communities on behavior change. When it comes to outcome number 2, where people were supposed to practice safety, hygiene to prevent the spread and transmission of COVID-19 at workplace, schools, and hospitals, automated dispensers were purchased or were procured, and these were strategically located. The first automated dispenser was positioned within Caritas premises, where also employees and visitors were able to get the services of the automated dispensers through the washing of hands and sanitizing and temperature check. The other automated dispenser was also located at Our Lady of Fatima Pilgrimage Center, a center that houses about 10,000 worshippers at a time during the times of pilgrimage, during times of ordination. The third automated dispenser was positioned at St. Martin of Tours Parish, that is in Mkanwini, to support or to render services to preschool children. At the moment, that automated dispenser is rendering help to preschool children. The fourth dispenser was positioned at a training center, that is Umtonjeni Pastoral Training Center, where different people come in for pastoral trainings. And the fifth dispenser was positioned at St. Pius Parish. So the role of the dispenser is really helped. The dispenser also was accompanied by COVID-19 messages, which actually stated that one has to be an ambassador of Caritas and ensure prevention or fight against COVID-19. These messages are all displayed in parishes. As part of prevention, there was also the disinfection program that took place at community level and in parishes. All these parishes were disinfected, and at community level, well ahead of funerals, disinfections would take place, and this was done by the COVID ambassadors.
The COVID-19 project has foreseen a positive impact in Bulawayo, Madobo, and Umzingwane district, reaching over 5,000 households who are now implementing the standard operating procedures of the World Health Organization, which include washing of hands, properly wearing of face masks, and maintaining social distancing. In addition, the implementation by the COVID-19 community ambassadors at community level has seen even school kids adopting the standard operating procedures, as we see school kids also sanitizing their hands when they enter creches and schools. This is seen in St. Martin de Porres, Mganwini, where school kids are sanitizing their hands when they enter.
A WhatsApp platform was established for the purposes of communicating issues related to COVID-19 prevention and control, and we confirm that he has proved to yield positive results, of which we are now looking forward to the competition that is supposed to take place at the end of this month as we conclude the program. Overall, we can safely say this program is on target, as the number of 30,000 people that was supposed to be reached was fully achieved through the radio broadcast. There are lots of feedback that come in from people, from various people in the society, men, women, boys and girls, all coming up and acknowledging the importance of this program. Thank you.